certain people need a little bit more advocacy because they're often overlooked. And interestingly enough, I didn't see this until later in my career. And it was just specifically at one place that I worked where I would see Black patients getting mistreated over and over again. And one of them happened to be my very best friend, like almost my sister. Um, and I always said, people are like, well, oh, what does it mean? People get mistreated in labor and all this kind of stuff. Well, it's having your concerns not being addressed or ignored. It's having procedures done to you that aren't necessarily something that you consent to or that you need. It's um not hearing you when you're saying, hey, like, I think that this is something that you should look into. It's all of those things. And oftentimes they're compounded. Um, and I was just seeing these things over and over and over. And it hit really hard because it was in my hometown. It was too, I just, so I felt like these was my people, you know? And especially when it happened to my best friend. So what happened with my best friend is she was trying to do a trial of labor after after a C-section, and it was stalling, and a doctor came in and was like, I need to check you. And I this doctor, I had already told my she was a resident, I had already told my friend, don't let her check you because she she's not a good doctor, right? And my friend was like, no, I don't want you to check me, I'll wait for a little while, because I was going to be her nurse in a minute. And the doctor just went, she had an epidural. Doctor just went and checked her. And I said, you can't do that. That is assault. So that's how it started. We had that conversation. Um, Shortly after, a code was called on her for no, she had like one D cell from a category one tracing, meaning that the baby was just fine. And baby had one little D cell. They called a code, but it was during change of shift. So a lot of people came in. They were trying to get her on the gurney to go into the OR, and pulled her epidural out of her back and putting her on the gurney. She did not know what was going on. Nobody stopped to explain it. Like I said, there was time to like stop and assess and say, hey, is this really something that we need to call a code C for? They got her in the OR. I went into the OR too. They prepped her and they were like, we're going to splash and cut. And I said, no, you're not. She does not have any anesthesia on board. Like, you're not about to do that. And I was like, let's call a safety stop. Nobody was listening. So many people were running around the room. I was like, I had to yell and throw my body across her so they would not splash and cut, and say, stop. She does not have medication on board. We need to stop and reassess whether this is actually needed. And, we stopped, reassessed. Of course, baby was category one again, went back to the room. I always tell people to have an advocate, someone who knows the process and can speak on your behalf and or translate things for you. It doesn't have to be a doula, it can be a close family friend, it can be somebody, but somebody you trust who can be there for you to kind of be a bridge between the doctors that can be doctors or nurses that can be decision makers, and you and what you want in your care. Sometimes you're not cognitive enough to understand. You're not mentally aware enough to understand what people are telling you, or able to express what you don't want or what you don't even understand, right? So I always tell people, bring somebody with you that's knowledgeable, and it's probably not going to be your partner, okay? Because unless they took some time to really study and understand. Um, and also, even if they are knowledgeable, sometimes they're so emotionally vested, they still don't understand what's going on. Somebody who can be objective in that, and that can look like I said, a doula, a friend, or another labor and delivery nurse, or me on Zoom. Y'all know I have people call me all the time.